Hi, my name is Dr. Scott Norton. I'm a practicing endodontist in Louisville, Kentucky, and I'd like to talk to you about the FlexoFile made by Dentsply Flexo. It is most useful in the apical third, and there are a handful of reasons for this. It's got great flexibility, it's got a non-cutting, safe-ended tip, and it comes in intermediate sizes. So let's take a look at the video and see the FlexoFile in action. We're going to introduce a number 15 FlexoFile into the tooth. I'm using a watch winding motion there, and I think the name says it all, and that the FlexoFile is a very flexible file, able to move around some very curvy areas and get into accessory canals, and just a great file. Each tooth is a little bit different on how much of the watch winding motion you need. Once we get down to length, we can use some glide material in there. This is a number 20 FlexoFile. We're going to use these, make sure all the walls are cleaned, and put the finishing touches on our canal preparation. We're into the MB2 with the number 20, and because of our initial use of the C+ file, now we're able to use the FlexoFile number 20 and get it down to length without much work. And we're going to do this in all the canals. Now I'm going to introduce a number 30 FlexoFile into the palatal canal, and a little watch winding there. And then I'm also going to use it to make sure the walls are clean there. And I'm going to introduce a 25 in the rest of the canals. And for a very dilacerated tooth, happy to get it to this size. And you can see the 25 there. Watch winding, mesial buckle, distal buckle. And let's see what we can do with the MB2 here. And so we're able to get that to length too. And these two canals actually join, which is good. And you can see, I'm going to show you here how that formed to the MB2 canal. And we're going to introduce the 40 to the palatal canal, making sure we get down to length there, not forcing anything. And that's our master apical file there. So what I'm doing right now is I'm taking a 25 sterile FlexoFile and I'm introducing the sealer into all the canals. And that way I can coat the canals with a master file. You know, we always remember that the sealer is actually what seals the canals. And so I'm applying it and making sure it's getting on all the walls. I've used the FlexoFile from Dentsply Flexo for years, and I find it works really great in my hands and my practice. Why don't you try it and see how it works in your hands and in your practice?